Hi, this video is the art of hair transplant restoration surgery on a black African American woman who has it's very unique, specific type of hair loss that's unique for black African American woman, where you have a receding hairline in both temple. And this type of hair loss, medicine might help a little bit, like Rogaine, but really is when it regrow mostly is peach fuzz, and you have to take medicine for the rest of your life. So another alternative treatment is hair transplant. It's one of the better treatment. Now, hair transplant is not a perfect solution, but it is come as close as we can. Sometimes you might need more than one surgery to have perfect density, and sometimes you can get away with one. But hair transplant is one of the best treatment available currently. But as you know, hair transplant, there's a very unique, especially this type of hair loss, and for women, and recreate the hairline is very complicated and very intricate. So to choose a surgeon or a clinic, you want to find someone who really specializes in the art of restoring unique hairline for black women or black men, or very certain ethnic hairline, because with experience you can have a very natural result. Without much experience, you can have either hairline like a really high arch up like Caucasian men, and they can really change your look. My goal has always been to recreate the hairline that's natural for you, not for your sister, your mom, or anybody. It's very unique for you. And there's quite a bit anatomical landmark I can do, or a rule of thumbs. And a lot of time I do take into consideration of your desire and how your idea of what the hairline should be. Well, in general, rule of thumb, from the mid-eyebrow to the hairline is around 4.5 to 6 centimeter. And so for this patient, she does not want, she said that her hair, she's born with a very high hairline, and she want to leave it natural, so with a large forehead. So with that, it's still not going to be 7.5 or 8.5 like Caucasian men, but actually hers is roughly around 6 centimeter. And when we build the hairline, we lower the hairline. We had to bring the temple in too. As you can see, if you turn this way, her temple is thinning, and we not only built the temple forward to make the forehead smaller, but we had to reinforce and fill in all those areas in the back, because this area is thinning as well. And if you can see that sideway, and it's another. So now we lower the hairline, bring the temple in. If we don't bring the temple in, then the forehead's really wide. It looks very awkward. And in general, no hairline straight, so we have very wide in width and high in amplitude. So those are the lead to more naturalness. And in the general rule of thumb, you can see it's kind of almost like an arc shape, like an average arc shape, but never going to be a straight line. Now, as you can see, this is just a very few detail that I explained to you, but there's quite a bit more, which will lead and contribute to a more natural look. Now, before we go further, if the audience who want to know more of my work, just please go on YouTube, type of Black Woman Hair Transplant Restoration Surgery Result with 1 year post-op with before and after photo by Dr. Diep. Or you can follow the Destiny Godly hair transplant experience, and she will explain all that stuff to you, which I perform her surgery. Or you can go to my website at www.mhtaclinic.com or call 1-866-999-6482. Getting back to this patient. So once we get the shape down, we will transplant at a very unique angle. For a black man, it's really pointed forward, flat against the skin, roughly around 15 degrees or less. For Asian man or Caucasian man, it's around 35-45 forward. It's a little bit higher in amplitude. But if you notice, not every woman, but a lot of women, black women, the angle is flat against the skin but pointed backward. And just look at a lot of pictures, you can see when you're pointed backward, it flare out like this. So the angle is very unique, and it's flat against the skin, and on the sides down and backward too. So the precise angle is very important. I realize it's curly when the hair grow up, it won't make much a difference, but it does make a difference how when you style it, your hair, or you gel it, it make it quite a bit different. My goal is not to change anything, but really to recreate whatever's natural for you. And with that in mind, we will follow the natural angle that you have by looking at all the residual hair that you do have. And then not only precise angle, but selection of hair graft. We transplant rows and rows single hair graft in the front, followed by reticular 2 hair, 3 hair, and 4 hair in the back for bulk and volume. In the back, as you can see, the goal is always volume and density and coverage. The goal in the front is softness and naturalness to reduce any detectability or any artificial work. And so with my work, we try our best trying to transplant as much as we can with very baby soft hair. Again, with that is really reconstrained by how much roots you have, what type of roots you have, because sometimes the patient naturally had thicker roots and form a little bit thicker result in terms of a little bump at the base, and it just all depend on the how your scalp heal and how your scalp produce. My goal is trying to do as much as we can and replicate as much natural we have for you. And we'll be attempting to do 3,000 grafts. We'll be shaving this baby hair here and there and fill it in as much as we can. And by a year time, she will look fantastic and she'll have a lot of density and her look will completely different. This is the art of hair transplant restoration surgery on a black African American woman with a receding hairline in the corner. Thank you.